The information contained in this episode is for informational purposes only. No material is intended to be a substitute for professional medical advice, diagnosis, or treatment.
We need a revolution. There's only one solution. I need somebody to show me love. We need a revolution.
Hello and welcome to episode 367 of Informed Life Radio on 1150 AM KKNW Seattle and streaming to CHD TV, Rumble, YouTube, and Facebook. Thank you for joining us. I'm your host, Lisa Templeton. Pardon me. If you find value in this hour of free speech radio you're about to hear, our nonprofit Informed Choice Washington could use your help to keep it on the air. I hope you'll consider a single or recurring donation. Go to informedchoicewa.org and hit donate. And thank you. To keep in touch with us and receive our cost-free weekly public health watchdog reports from Washington State, subscribe to informedchoicewa.substack.com. The views expressed on this show are not necessarily those of KKNW or CHD, and the information provided is not intended to be medical or legal advice. Before I bring on our wonderful guest, I want to give you a little update. We've been telling you about the upcoming world premiere of Duty to Disobey on June 30th. That's the film from CHD and Tommy Burrows' production that reveals the injustice experienced by U.S. service members who refused the COVID shot and why their story matters to every American. Your volunteer CHD Washington chapter leaders, of which yours truly is one, have arranged for screening in several locations around the state that will show this important documentary on Tuesday, June 30th. Now, you might be aware we had a deadline of last Friday for 50% of the seats to be reserved at any specific location in order for the show to go on there. And we have good news today because not all of the locations tipped, which is what happens when they get 50%. The theaters have extended that date to next Friday, May 28th. So please go to dutytodisobeyfilm.com to watch the trailer and grab your seats now. And please share this opportunity with others. I'm going to show you a quick 1-minute trailer. I showed this a couple of weeks ago, but I think it's so powerful, it's worth watching again.
The incredible service members.
And we owe you our freedom.
The Pentagon is going to require vaccines for all service members.
I'm asking the Defense Department to look into how and when they will add COVID-19 to the list of vaccinations our armed forces must get.
Leaders did everything legal or illegal within their power to coerce and influence their service members to get the shot.
Her son and 9 other Marines were being held in confinement in the brig until they got vaccinated.
If you don't do what they tell you to do, they will ostracize you. They will destroy your life.
8,000 well-trained men and women were fired.
I lost my ability to feed my family.
I mean, I'm being told you're getting dishonorably discharged.
You cannot mandate an experimental medical product on military members.
The impact is really on the entire nation.
I had a battalion commander come to me and she said, "Dear God, we're killing our own soldiers."
When we talk about orders that are unlawful, now there is a duty to disobey.
So you're not going to want to miss this, and it will be a good chance to find like-minded people and open-minded people. The locations in our state are Seattle, Federal Way, Tacoma, Burlington, Spokane, Tri-Cities, and Vancouver. So again, go to dutytodisobeyfilm.com to reserve your seats. And even if you can't attend, if you would like to support that show, you can still go reserve a couple of seats, give them away, or just try to make sure that these theaters tip so this message reaches as many people as possible. Now I get the pleasure of bringing on Dr. Stuart Nunnally. He is a world-renowned biological and integrative dentist practicing in Marble Falls, Texas. You're going to get to hear his beautiful accent today. He probably thinks I have an accent. Dr. Nunnally is a board-certified professional in both naturopathic medicine and integrative biologic dental medicine, and he's very active in the International Academy of Oral Medicine and Toxicology, IAOMT. His practice specializes in holistic dental care, including cavitation surgery. Dr. Nunnally frequently teaches on biological dentistry, and his patients come to him from around the world. And I had the pleasure of meeting him at the National Health Federation conference last month, where he gave a compelling presentation about root canals, cavitation, and treatments. And during the question and answer session, one member of the audience, one of Dr. Nunnally's former patients, stood and tearfully thanked him for his care years earlier, indicating that it had given him his life back. And the whole reason that man went to that conference was just to see Dr. Nunnally and to be able to tell him that. So with all of that, welcome, Dr. Nunnally.
Thank you, Lisa. It's great to be on your program. I appreciate it very much.
Well, we're excited for you to share this information with our listeners. I would imagine a lot of our listeners may have already been familiar with the problems surrounding root canals and cavitations. But for those who are new to biological dentistry, what does that term mean, and how is that different from conventional dentistry?
I would say that biological dentists distinguish themselves from traditionally trained dentists in that they are very, very careful about not using dental materials that might challenge a person's immune system. So there are, as you know, there's a huge list of dental materials available to us. And most biological dentists that I know look at those very carefully. For example, one of the bonding materials that we use is made by a company from Germany that specializes in making biocompatible dental materials that don't challenge one's immune system. So I would say that's one of the distinguishing features of a biological dentist. Other than that, I would say a biological dentist is going to be looking at the patient's overall health in terms of what dentistry might do to their systemic health. And so I would expect, at least certainly in our office, we have a very in-depth history of a patient's systemic health issues so that we can tailor the dentistry in concert with their systemic health.
That's wonderful. I love the idea. And, the more I learn, the more I realize this body is so many integrated systems. It can't just be kind of chopped up into completely separate parts that seem unconnected, because they're just not unconnected.
That's correct. Now, I think so long in dentistry and medicine, there's been a disconnect. And one of the most wonderful things that has happened over the years for me is that I have many, many physicians from around the world that I have relationships with, and we partner together in terms of trying to build in concert treatments that would really benefit the patient. And it's so interesting. For example, sometimes the patient's physician is in charge of their nutrition, which is so important to us before we do their dentistry. Occasionally they're not, and then we will take over in those instances. But I love to partner with a physician who's sort of quarterbacking the patient's overall systemic health, and then let me come in and clean up the toxicities, and then we all get to see together and how the patient improves.
Wow, what a great approach. Who would have ever thought the dentist and the physician would be working together? That's just such a good approach. what happened in your own life that prompted you to transform your practice from conventional to holistic? Because you didn't start out with this approach, did you?
No, I didn't start out with this approach. I started out as a cosmetic dentist and a dentist. I loved treating TMJ type issues for patients. And I did that for 20 years. I didn't place a mercury filling for almost 20 years. I did the first 2 years after I got out of my dental training, and I knew better. I knew, number one, they looked awful. And number two, I had been a chemistry teacher. I knew that mercury was not stable in a mercury filling, that it would be releasing mercury vapor the entire time that it's placed. But we go through a brainwashing in our training, and so I did for the first 2 years. But about year 22 into my practice, I got sick, and I was a competitive triathlete, and I went out for a training run, and I developed just cramps that I could not run through, and there was not much that I could not run through in those days. But at any rate, the same thing happened the following week, and then I began to notice I was having muscle fasciculations, which is twitching of muscles that you can see. We've all seen those around our eyes and so forth. But this was worrisome. Virtually every muscle in my body was twitching, and a number of other neuromuscular issues. So finally, after months of testing by my neurologist, I was referred to the ALS Center in Houston. I was convinced that I had ALS. I had a number of the symptoms, but as it turned out, no, I did not. Thank God. I had a mercury toxicity issue. And so I actually, at that time, I called.
Was that from a filling or from another source?
Yeah, I certainly had some fillings, mercury fillings as a child, but those had been removed many years ago. But as a dentist, if you're not taking precautions yourself, you're just sitting in a little mercury vapor fog as you remove them. I was removing mercury fillings robustly from physicians were sending their patients to me because they knew I would take them out. But I wasn't taking the precautions that I needed to for the patient or for me or my staff. And of course, I changed all of that 25 years ago. And so we're very, 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 very careful about protecting the patient, of course, but also my staff and myself.
Yes. So how did you overcome the issues that had developed from the mercury exposure?
That was a very interesting time for me. Of course, it was a sad time because we thought at the time things looked so bleak. But I actually went to see the grandfather of holistic dentistry. His name was Hal Huggins. And I called him. I said, Dr. Huggins, you don't know me, but I'm a Texas dentist. Looks like I have ALS. Would you mind seeing me? And he had seen many patients with all ranges of autoimmune diseases and cancers for years and years. He had lost his license for telling people to have their mercury fillings removed. And so, but at that point, he was seeing patients in Montreal and Puerto Vallarta. So I went to see him in Montreal. He took me through his 2 weeks worth of blood, hair, and urine chemistries and changing my diet. I was super, super lean. And so as a result of that, and by the way, the first question he asked me when I called him, Lisa, which I'm sure we'll get to later, but the first question he asked me, he said, did you ever have wisdom teeth removed? And I said, yes, I did when I was in college 30 years ago. He said, well, if you have cavitations, you're never going to get well. So I had barely been introduced to the concept of cavitations before that. So part of what he did for me in Montreal was clean out my cavitations and redo even the bonded fillings that I had were not biocompatible. So we had all that redone, and then I followed very closely with his recommendations for detox, which was basically to go slowly. Sometimes if you detox too quickly, you retoxify and you can certainly become more ill. But I went slowly, as he suggested, doing IV vitamin C's and saunas. And gosh, over a course of really 3.5 years, I was finally back to jogging again and actually competing again in triathlons. But it was quite a long stretch for me.
Wow. Thank goodness. I mean, yeah, I'm
Mm-hmm.
sure the expense and the physical anguish and effort were a lot to take on. But that's a good story.
Well, and sometimes it takes a story like that to push you in the
That's
direction
right.
you need to go.
That's right, isn't it?
Yeah.
Tell our listeners, what is a cavitation, please?
Yeah, well, a cavitation is an area in a bone. It doesn't have to be jaw bones. It could be any bone. The jaw bones are just the most common. It's an area in the bone that has a very sluggish blood flow or no blood flow. So in the medical world, we call that ischemia or slight blood flow, or we call it an area of no blood flow where the bone becomes necrotic or dies. And so you can find either or in a cavitation. Typically in dentistry, we find the cavitations where teeth have been removed. So the tooth was removed, bacteria from the mouth go into the socket if they weren't there already. Let's just say it's a wisdom tooth. Let's say the wisdom tooth is removed. The bacteria from the mouth go into the socket, and the body, in an attempt to heal that, covers the top part over with gum tissue and a little cap of bone. But underneath there, where the tooth roots used to be, you still have this festering, really kind of a cesspool of bacteria and their toxins. And it's been recognized in the literature for well over 100 years, and yet in dentistry, especially in the traditional realm of dentistry, we've just chosen to ignore it. It shouldn't be ignored because the bacteria in there are an issue, but even more so are the toxins that they produce. And it's true for many diseases. Sometimes it's just the bacteria or the virus, but many times the toxin is even more potent and causes the majority of the problems. I think that's true in cavitations. So the first one of the first gentlemen to identify these many years ago was Weston Price, and he knew that there were toxins in there. He didn't know which ones, of course, 100 years ago, but now we do know, and they can be very potent and quite a challenge to our systemic health.
Yeah, you know what? People probably might expect that if there had been a problem or an infection after, say, a tooth extraction, that they might expect like a fever and maybe pus.
Mm-hmm.
But why wouldn't? Is it because it's bone that those things don't happen, or to signal
really,
somebody?
You know, that's a great question, and that's been pondered for years. Why would you have basically an infection that just festers and it not hurt? Well, it can happen. In fact, it happens all the time in periodontal disease. Those things fester and they rarely ever hurt until maybe the tooth gets so loose that it falls out. So there are infections in the body. We can have them most anywhere. There are certainly gut infections that we're not aware of. When they get bad enough, they do hurt. But it's true in bones, for sure. And sometimes people will take a blow, for example, to their hip. They won't realize that that the hip has become necrotic or died, and now it's collected bacteria. The body doesn't like any area of the body to become stagnant. Stagnant areas usually become infected. And so that's what happens in the case of a tooth removal many times. And I think we as dentists, I think oftentimes we're at fault because we should, when we remove a tooth, number one, we should thoroughly clean the area out and remove what's called the periodontal ligament that attaches the tooth to the bone. If you don't remove the ligament, that's very difficult to reintroduce bone into that area. And two, in dentistry, we like, as dentists, just as any physician likes, you like to work in a field that's not all that bloody because you can see better You can close it up better. You can suture it better. And so in dentistry and in medicine, oftentimes epinephrine is used in an anesthetic to dry up the field. It causes the blood vessels to shrink, and so you don't have as much bleeding. Well, that's a problem because when you don't have enough bleeding, you don't get enough blood flow into the area to allow it to heal. So I think it's very, very important that we as dentists, when we do surgery, and especially surgery involving the bone, to use as little epinephrine as possible in our anesthetics.
Oh, I didn't think of that. Okay. Wow. So for people who are out there saying, oh no, I've had wisdom teeth removed, I've sent my kids for that because we didn't know any better, what should we do now? And how do we know whether there's a negative effect?
Yeah, well, that's a great question, and that's the one I get all the time. One is, remember this, and anyone listening who has children, and if they still have their wisdom teeth, if there's room for those wisdom teeth, God designed you to have 32 teeth. We oftentimes now in America, oftentimes our jaws have shrunk to the point where we can't accommodate all 32. And so if they're crowded, as they were in my case, I had my wisdom teeth removed. In the case of my 3 children, 2 of them got to keep their wisdom teeth, which I'm delighted about, and 1 did not. He didn't have enough room. So, but what I would say is I think far too many wisdom teeth are removed because a dentist will say, well, you can't keep those teeth clean. Well, that's nonsense. You can keep the teeth clean if they have room. So, number 1, keep your wisdom teeth if you can. Number 2, get them removed if they need to be because maybe they're crowding the other teeth or jeopardizing the teeth in front of them. But if you do have them removed, you want to have them removed by someone who's going to really clean that socket out well. And I think it's important, and I should go ahead and mention this now. There have been so many wonderful things that have happened in the realm of dentistry over the last few years. One of the best, most wonderful, is that we can draw a patient's blood before surgery, spin that blood down in a centrifuge, and take their platelets out. Platelets have this incredible healing capacity. And so if we can concentrate those platelets and take them out of the tube and put them right into the extraction site, you have a far better chance of not having what we call a cavitation, or especially having what we call a dry socket. A dry socket is where the hole doesn't heal at all, and it's extremely painful. I had 2 of them myself when I had my wisdom teeth removed, and I remember how painful that was. But that is basically eliminated totally by placing platelets into that socket, and the healing is much quicker.
Okay. And what's that procedure called? Is it what's the name of that platelet?
That's good because platelets now have been used in medicine and dentistry for a number of years. The first generation of that was typically called platelet-rich plasma, or PRP.
Okay. Yeah.
But in dentistry now we've changed that somewhat to PRF, which is platelet-rich fibrin. The fibrin we spin those tubes at such a rate that we get the fibrin and the platelets and white cells all in one, and it makes a nice thick gel consistency so that we can handle it very, very well and put it right into our surgical sites.
Wow. That's really exciting.
It is.
So kind of getting back to bringing in root canals here too, what's the difference between a root canal and a cavitation? And do they sometimes overlap, I would imagine, in creating a chronic burden?
No, you're exactly right. Many times, yes. So a root canal treated tooth is this. Many times a tooth, if it's had decay or maybe it's had trauma, it will begin to hurt because the nerve has now become infected. And the only way to remedy that is either to remove the tooth or to remove the nerve. And in the process of doing a root canal, the nerve and the blood supply to the tooth are removed. And let's say it's just a front tooth, a central incisor. That typically has one large canal, and the dentist or the endodontist will go in and remove the nerve and the blood vessels in that one canal. The tooth is then dead. It has no more blood supply. But one of the problems with that is the dentist, when he removes the main nerve and the blood supply, he cannot get to all of the little accessory canals that are in a tooth that also have nerve tissue in there. And so now you have this dead tooth with what science has determined is up to 2 miles worth of little microscopic tubules in a single rooted tooth with tissue in it. And the bacteria now have an opportunity to feed on that and to replicate and to produce their toxins in this wonderful environment where you no longer have a blood supply, so that the body cannot deliver its own immune defenses to the tooth. Well, that can be a problem because now we know very well what those toxins are. And the toxins are the same toxins that we find from the bacteria and cavitations. And I'll give your listeners kind of a long term. It's called a lipopolysaccharide, or LPS. It, interestingly enough, is the same toxin that we find from leaky gut. So teeth can leak. And this was a term described many, many years ago, over 100 years ago, by Weston Price, just like a gut can leak. Neither one is good. Both of them have a common toxin, and it's LPS, or lipopolysaccharide, which is a potent toxin. Even if you can imagine this, not only can we have systemic health issues from it, but we can also have emotional and neurological issues in terms of depression, in terms of cognitive disorders. And so we wouldn't think of a root canal having that kind of potential impact, but it certainly can.
That doesn't seem like a good idea to just basically destroy the nerve to a tooth and the blood supply. Is that ever indicated?
Well, I think it's not a good idea. The problem is nobody wants to lose a tooth. And I understand that. It's a question that I have posed to me literally every day that I'm practicing. And I'm very, very sympathetic to it because who wants to lose a tooth? For example, I'll give you an example of it. I had and still have a hygienist who's worked for me for 31 years. She is a fabulous lady. And when she had worked for me for just a few years, she was a young mama, very active, jogger, healthy woman. She was sitting at one of her children's softball games, and the softball came over and hit her squarely in her front teeth. Well, within a day or two, one of those teeth abscessed. It just took such a blow. So this was back 25 years ago or more when I was still doing root canals. I did a root canal for her. And then shortly thereafter, the other tooth next to it died. So I did a root canal on that tooth. And within a matter of weeks, she began to have rheumatoid-like symptoms. This is a perfectly healthy young lady, to the point of within 6 months, she could not get out of bed. And so she and I prayed about this. This was the first time I had ever removed root canal treated teeth on anyone because of their systemic health issue. By this time, she's already seen a rheumatologist. She has the diagnosis of rheumatoid/lupus, and she had blood work to back that up. And so we removed her 2 front teeth. I've told people for years this was like removing 2 front teeth on my daughter. Can you imagine taking out 2 front teeth on your dental hygienist? Well, we did. And of course, we made something real pretty for her to have in there so that no one would have known she had teeth removed. But within a few weeks, almost all of her symptoms were gone. Her blood work returned back to normal. And so I had this true cause and effect to watch.
Yeah.
And here's one of the most remarkable things about this. A few years later, her symptoms began to return. We took another x-ray, and lo and behold, another tooth up there was abscessing from the same blow that she took years ago. She was unaware of it. Occasionally, an abscessed tooth is not painful. In her case, it was not. We removed that tooth, and then once again, her symptoms went away, and she's lived very normally for the last 25 years or so. So it was the first case where I got to see a true cause and effect. And now over the years, of course, I've seen it over and over again.
Yeah, twice.
Yeah.
For people who have had some trauma to a tooth, but didn't, nobody told them to get a root canal at the time, will it be obvious later that the tooth has basically died?
Well, I love that question because not always. It's not always obvious to the patient. It's actually not even obvious oftentimes to the dentist. Within the last 15 years, we have a new way to image teeth, not just with a normal two-dimensional x-ray, but now we can look at a tooth from 3 dimensions, and it's called taking a cone beam image or a CBCT image. It's basically a CAT scan of the head and neck. And so the beauty of taking that image is that we can look at a tooth in 3 dimensions. And there was just a study released, it was just within the last few weeks, that showed that when you examine all root canal treated teeth with the cone beam technology, 43% of all of those teeth have a blatant infection at the tip of the root.
Oh, no.
Now, you hardly ever, you don't see that many with just a 2-dimensional x-ray. But what that means, Lisa, is this, and that's why I look at this I look at this with such interest, and I look at this always in terms of the patient's overall health. When you see that sort of infection at the tip of the root, the patient is much more predisposed to cardiovascular events. They're much more predisposed to cerebrovascular events, in other words, stroke, and overall, and much more predisposed to health issues all in all. And can you imagine, this is the data. In this country, in America this year, 25 million root canals will be performed. Now, if 43% of them basically fail or have an obvious infection, that means that over 10 million of those 25 million root canal treated teeth are going to fail blatantly. Well, my main objection to people having a root canal without an informed consent is this. Rarely ever, I don't know of any endodontists who say to the patient before they do the treatment, they should say to the patient, in this country, 25 million root canals are done every year. It allows people to save the teeth most often, but I want you to know that you have about a 40% chance of the root canal developing an infection, and that's going to predispose you to heart attack, stroke, many other health issues. Most people probably would say, you know what, I think I'm going to pass on having the root canal, and I'm going to do something different. So I think the problem for dentistry and endodontics in general is that we don't inform the patients well enough. I'll give you the hard data on just heart attack alone. And this study was done in 2019. The study showed that if you had one of those infections at the tip of the root, which I just said 43% of them will, you had a 5.6-fold increased risk of a cardiovascular event. Well, 5.6-fold means 560% more of an increased risk of a cardiovascular event. Now, I think if we as dentists informed our patients of this, number one, I think they'd be grateful. And number two, we would be telling them the truth. And number three, we might prevent a huge range of cardiovascular, cerebrovascular, and other health issues that I think root canals contribute to.
Mm-hmm. And is that from the toxins, or do we know the mechanisms by which these events are increased in prevalence?
It's both toxin and it's also the bacteria themselves getting into the bloodstream. So, and this is how the data has been determined scientifically. If you take a patient who's had a heart attack or is having a heart attack, and during the process of, say, replacing the vessel in a heart, if when they take that vessel out and they graft in a new vessel and they submit that vessel for microscopic study, they will find the same bacteria in the vessel that you find in the root canal treated tooth. You will also find it in the stroke victims' vessels and their cerebral vessels. When they sample what's in those, they find the same bacteria that you find in the root canal treated teeth. So, and that information, believe it or not, has been available for 10 years, and yet you cannot get the profession to acknowledge it and to embrace it.
Well, does that necessarily mean that the bacteria was the cause of the event?
Sure.
Have they looked at that?
Yes. I think it's, if not the cause, at least it exacerbated it and it elevated the patient's chance of having a cardiovascular event. So I like to be sure and educate my patients. I always actually give patients the choice. I try to educate them on the health issues, but I get it. People don't want to have a tooth removed, and if they say, you know what, I'm going to take my chances. Say, well, I'm going to get you to the best endodontist I know in the country. And you go, and they're going to use ozone in there, and they're going to do everything they can. So often the patients that I see are already sick with an autoimmune disease or cancer or some other debilitating systemic illness, and they don't want to take the chance, and I don't either, of challenging their immune system. So we can do all kinds of things to replace teeth these days. And in a healthy patient, many times we'll use a zirconia implant to replace the tooth, which we find to be very biocompatible. Much more so, we think, than titanium. But we can do other things too. Sometimes if it's a very back tooth, we don't have to replace it at all. It's not going to show when a patient smiles, and they adjust to it very, very well in terms of their ability to chew. So there are many, many things we can do to replace teeth and still spare the patient a toxic event.
Okay, this is a good time for me to mention your website, because you have so many wonderful videos that go into these different dental materials and beneficial practices such as oil pulling and some of the modalities you offer. And that is, what's your website?
Well, it's healthysmilesforlife.com. I have several great partners. I have two female partners who have been with me for many, many years, Lane Freeman and Candace Owens, and they're just fabulous. And then we still have other partners who help us, but those two ladies have been with me for 25 years and 18 years respectively. Yeah.
And that says a lot. So yeah, even if you can't go see Dr. Nunnally in Texas, please check out his website. Just a quick question. The 3D cone beam imaging, that is not the same as a panorama, right?
No, it's not. You get
Okay.
you automatically get a panorama view when you do the cone beam, but the cone beam will allow you to analyze the panoramic view in 3D as well as individual teeth as well. I was just thinking, it just came to my mind, and maybe you were going to ask me this, Lisa, but so oftentimes at the end of a lecture or talk that I'm giving, someone will ask, well, what can I do as a layperson to find a dentist who who thinks biologically and would consider themselves a biological dentist? Well, there are two organizations in this country that have done a lot of training for dentists. Many traditional dentists have gone through the training of the IAOMT, that's the International Academy of Oral Medicine and Toxicology. So IAOMT.org is a way to help find a dentist in your locale. And then there's another organization called the IABDM, that's the International Academy of, well, I don't even remember what that's an acronym for. International Academy of Biological Dental Medicine. Yeah.
Okay,
anyway,
thank you.
Yeah. So both organizations are fantastic. I've been a member of the IAOMT for many years, and it's now, fortunately, is a large organization. When years ago when I started, I think we had around 100 members, but now worldwide probably 1,800 members. And so many of those members have been through what we call SMART training, and they're certified in SMART, that's safe mercury amalgam removal technique. And so if you see on that website that the dentist has been SMART certified, you know that at least they're going to remove your mercury fillings and what other heavy metals you have in your mouth in a very safe manner. So I wanted to make sure and mention that, because sometimes people leave this sort of interview and don't know where to go.
Yeah, that's very good. Well, you anticipated my next question about the IAOMT SMART protocols. Let's see, we have about 9 minutes left. So can you give us a quick overview of what that entails? I know you alluded to that earlier.
Yes.
In your own practice, how before you knew any better, you weren't using those.
Here's what I would do if I were a patient. I would first look to see if they're SMART certified. If I were going to a new dentist, I'd look, are they SMART certified on the IAOMT website? And if they are, that's a good first step. And then I think I would go interview the dentist and his staff, and I would say, what kind of precautions are you all taking when you remove mercury from a patient? And they ought to be able to tell you and show you. I mean, basically the dentist is going to almost look like he's in a spacesuit when he's removing mercury, because he's going to have a respirator on, and so will his assistant. The patient is going to be draped from head to toe, so none of the particulate of mercury that is removed is going to get on them. There's going to be a giant air vacuum in the room. It sounds almost like a jet engine that's just pulling the air and the little microscopic particles of mercury off and out and filtering that. And then, of course, and one of the things that's just mandated now, and I know it's not being adhered to by all dentists, but all dentists are mandated to have mercury separators on their vacuum systems. So what we take out of a patient's mouth doesn't go into the public water supply. Mm-hmm. For years, dentists were the number one in terms of contaminating public water supplies with mercury. Mm-hmm. But thank God now that's mandated that dentists have a mercury separator on their vacuum systems. And so I would just check with the dentist. I would ask those questions. And if they stumbled on any of them, I would go down the street. So I think that's first and foremost. I would
because
also, oh, I'm sorry, Lisa.
oh, go ahead, Dr. Nunnally.
Well, I would say that would be a key question for me. Another question I would say, I would ask the dentist, well, are you using fluoride on your patient's teeth? And if they said yes, I would say, then again, I would say, well, thank you so much. I'm going to go find somebody who doesn't. And here's why. And it's a question we get all the time. Why don't you value placing mercury on someone's teeth? I said, well,
do you mean fluoride?
Pardon me, fluoride. And I would say this, well, I value the patient's health so much, I wouldn't dare put a toxic substance like fluoride in their body, because every cell in that patient's body is going to be using iodine, especially, of course, the thyroid. We all know that. And fluoride outcompetes iodine every time. And so it's a very, very active element. And we're all kinds of ways to protect people and help them prevent cavities and decay without using fluoride. So that would be another key question for me.
Very good. What you said about going down the street reminds me of a little comic I saw, speed dating. The man and the woman are sitting across from each other, and the guy goes, what is fluoride for? And she says, it prevents cavities. He goes, next.
Well, that's good. A lot of truth to
that. Let's see. We have 5 more minutes. So can you tell us a little bit, because I know you use all these wonderful supports in your practice, such as ozone that you mentioned, IV vitamin C, the platelet-rich fibrin, filtration, oxygen, and even acupressure. And tell me how those fit with the body's natural healing process.
Well, I think most people would agree that vitamin C is a master detoxifier. And so when we're removing toxins like mercury, an ample supply of vitamin C is fabulous. The body loves it. Not that it chelates mercury, it's a very poor chelator actually, but it tends to amp up our other wonderful detoxifiers that we have in our body. And so that's why we love to have it on board. We love to use acupressure, for example, for our patients before and after surgery and even the following day, because the more we can keep a patient in a beautiful parasympathetic state, the better they heal. Mm-hmm. And it's another reason why we sedate our patients. Most of our patients come from long distances, and we do all the dentistry typically at one time. We don't have to, but we typically do. I think it's better to remove all of the toxicities at one time and give the immune system a jump start. But we do that under sedation because it's so calming for the patient. And actually, as they wake up to having an acupressure session, which is much like acupuncture, but without the needles. And yeah, very much like it. And what we're doing, a skilled acupressurist is reopening these blocked energy pathways that happen from dentistry. Metals block it. In other words, and not only just the metals that are in fillings, but metallic implants can block those energy pathways. We call them acupuncture meridians. And so a skilled acupressurist can reopen those. Dead teeth will block. They act just like a circuit breaker on an acupuncture meridian. And scars in the mouth, scars anywhere can block acupuncture meridians. So all those we try to address, but one of the ways we do it is with acupressure. We love acupuncture too, but with acupressure, a patient is allowed to still stay fully clothed, and a skilled acupressurist is just touching those acupuncture points to reopen those blocked meridians.
And once they're open, are they open for good if there's not another insult, or is that something that needs to be done periodically?
I think it varies from patient to patient. So interesting. You know, sometimes patients come in just having terrible brain fog. And so interesting how when you reopen those meridians and remove the toxicities, sometimes literally the next day they say, I can't believe it. My brain fog is gone. For other patients, it's a process, and then we will encourage them to have other acupuncture or acupressure treatments over the following weeks, as well as we really do encourage them to also follow up with having vitamin C IVs over the next few weeks and months. It elevates their glutathione, and glutathione is this just little master detoxifier that God put in us. And we love to see a little extra vitamin C put on board because it keeps the glutathione in a state that really helps it to grab onto toxins.
Beautiful. I just love this holistic approach. And kind of rewinding a little bit, when you were describing how to have people interview their dentists and looking up their IAOMT SMART protocols, even if you, patient, aren't getting mercury removed, you're going to want to know what kind of safety protocols the dentist uses, because you don't want to go into an office that's covered with this stuff.
No, you're so right.
Tiny pieces everywhere.
You know, when I got sick years ago, that's one of the things. I stayed out of this office for 6 weeks until we had every surface redone. We brought in an industrial mercury sniffer to make sure there was not a trace of mercury left. Otherwise, I would not be working.
Wow, insidious. Well, Dr. Nunnally, tell our people one more time where they can find you, please, and all your wonderful videos, even if they don't have the pleasure and privilege of going to your very own practice.
Well, thank you. Find us at healthysmilesforlife.com. We're in a little country town outside of Austin, Texas, Marble Falls. So most of our patients fly into Austin, some San Antonio, some even Dallas. It's not too far. We're kind of in one of the prettiest little parts of Texas. We don't think of Texas as having rolling hills and lakes, but ours does. And that we've chosen to keep our practice right here where my wife and I grew up because it's such a beautiful place for people to heal.
Lovely. Well, thank you so much. Pleasure having you here.
Thank you so much, Lisa.
And join us next week for our talk with Charles Frohman, lobbyist for National Health Federation, who focuses on EMF regulation reform as a part of health freedom. And I'd like to thank our excellent producer at the station, Nathan Miller, for all his work behind the scenes, making sure we have a quality presentation. And thank you, ladies and gentlemen, for tuning in to Informed Life Radio on 1150 AM KKNW and CHD TV. This is your host, Lisa Templeton, signing off for the week. Here's to embracing your informed life. Have a good weekend.
Informed Choice Washington is a nonprofit organization that advocates for healthy immunity, medical freedom, and fully informed medical consent. The right to make medical choices without coercion is fundamental to our civil liberties and a basic principle in all human rights declarations. To learn more, tune in each Friday from 4 to 5 p.m. to an Informed Life Radio and visit the website informedchoicewa.org. It's time to take a stand for medical freedom. Go to informedchoicewa.org today.
Did you know that solutions containing iodine can inactivate viruses in the nose and throat in 15 seconds? And hydrogen peroxide can do it in under 30 seconds. Decades of studies, including many conducted during COVID, have shown that properly prepared and used nasal spray and gargling solutions can reduce your risk of infection, reduce viral load, reduce symptoms, and reduce transmission of viruses. To learn more, go to healthyimmunitynow.org and check out the EFU Challenge. Why spread fear and infection when nature provides solutions? Go to healthyimmunitynow.org today.
The information contained in this episode is for informational purposes only. No material is intended to be a substitute for professional medical advice, diagnosis, or treatment.